excited to have you participating in this webinar called Maximizing Your VISTA Healthcare Benefits. My name is Khadija Carr and I'm presenting from VISTA headquarters in Washington, D.C. You will also see our colleagues from LSI in the chat and Q&A, Sabrina and Julie.
And hello everyone, my name is Matthew Nelson. I'm the Program Manager from International Medical Group, or IMG. I oversee the benefits administration and operations at International Medical Group, make sure we're the ones providing good coverage to y'all that we'll be discussing today.
So now that we have introduced ourselves and before we jump into the presentation, let's take a look at today's agenda. We are going to look at deciding which plan to select, how to enroll in one of those plans, and we will also be discussing using your plan and how to access support. And to start, we'd like to ask you to please answer the poll question. We'll leave the poll question open for a short time because it's just a quick question. So using the poll feature, have you enrolled in a VISTA healthcare plan option yet? You may select yes. The VISTA healthcare allowance plan is what I've enrolled in. Or yes, I've selected the VISTA health benefit plan. Or maybe it's no. I have not enrolled in a plan. Or it's wait, do I have to enroll? Please record your response.
And I'm actually pretty interested to see how many of you have enrolled, and you're going to have your questions about maybe your plans today and what we can do to help with that. But as well as those of you who might not have known that you do need to enroll, so we'll see some of the results popping up here.
Yeah, it's looking like the bulk of folks have selected the healthcare allowance plan. And there are only about a couple of folks that say, wait, do I have to enroll? So we'll answer any questions that might help you with this healthcare enrollment process. And let's keep on going with the presentation. I think that's quite interesting to see that so many of you have already enrolled in a plan. So now that we've learned a little bit about if you have already enrolled in a VISTA healthcare plan, the question that really surfaces is, am I required to enroll? And essentially, do I have to select one of these benefits? So for the VISTA program, if you want to participate in one of the two healthcare benefits offered through the VISTA program, you do need to enroll in a benefit because there is no automatic enrollment. You will select between the healthcare allowance or the health benefit. And since healthcare can be very complicated, confusing, and very personal to your own situation, I'm going to ask that Matthew Nelson gets us started by reviewing some of the essential terminology that's related to health. Matthew, are you ready to help us get started with the basics?
Yeah, absolutely. So again, my name, as mentioned, is Matthew Nelson, and I work to manage the AmeriCorps VISTA Health Benefit Program at IMG. It's a pleasure to join you all today, and what we're going to do is help, as the title of the presentation is, help you maximize your VISTA healthcare benefits. We do have a lot of ground to cover, so I hope you don't mind me jumping straight in a bit and stick with me because there's a lot to talk about. Since healthcare coverage can be a bit complex, at first, what I think we're going to do is try to define a few key terms that may be important for you to know. So on the screen, you can see some of those key terms. We'll start from the top, benefits and exclusions. A benefit is what a plan includes as a covered service. An exclusion, then, is what a plan specifically says it does not cover for. Next is primary insurance versus secondary insurance. A primary insurance plan is responsible to always handle maybe a medical bill first before any other insurance plan. A secondary insurance plan must always pay second after the primary insurance plan finishes handling the claim completely. Using a secondary plan Usually, a secondary plan needs to know that the other primary insurance plan is done handling a bill before it can take its turn. Another key term, especially on the VISTA plans, would be pre-existing conditions. The definition of this may actually differ between different insurance plans, but generally it just means a condition that existed before a plan began. The VISTA health benefit plan is going to define this as any condition or illness for which medical treatment was given or a diagnosis was made on or before your start of service. So it's important to remember that if a condition was diagnosed before you began your VISTA service or treated before you began VISTA service, it can be defined as a pre-existing condition. We're going to discuss that a little bit more later on. Some other key terms that are going to help you with understanding your coverage are listed here. These all have to do with different types of out-of-pocket expenses you might see on a standard insurance plan. So on the left you see deductible. That's an amount that a plan says you owe before the insurance plan will pay for the benefits that are included. A copay is a fixed out-of-pocket amount that a patient owes to the medical provider before the services are provided. Then a coinsurance amount is a percentage of the cost of a covered health service that you pay after your deductible. It's similar to a copay, except it's a percentage and it's usually the last part of the equation. So now that we've got a few key terms defined on how health coverage works, let's decide which plan to select by going over the two options available to VISTA members. So the first option here is the healthcare allowance plan. And actually, I like seeing the poll in the beginning. Most of you seem to be enrolled on this plan. And that's what I'd expect. This plan is for people who have other insurance coverage already, whether it's through a parent, a spouse, or if you'd purchased your own plan, maybe through healthcare.gov marketplace or your state marketplace, or if through those marketplaces you ended up being enrolled in Medicaid, Medicare, or even TRICARE. The healthcare allowance plan is going to work alongside your other insurance to pay any copays, deductible, or coinsurance that you would normally owe on a medical bill or service after the other plan. The other plan is the health benefit plan. This benefit plan is for those who have no other insurance coverage. It works on its own, providing limited benefits, but they're meant to assist you with any illnesses or injuries that originate and occur while you're in service. So here's them side by side, a quick comparison of the two plans. So going over again, the allowance plan, one of the main differences, you do have to have some other form of health coverage, and with the health benefit plan, the difference being you don't. It works on its own. The allowance plan is always secondary to your other health plan, though. With the allowance plan, your primary insurance will have its own copay, deductible, and coinsurance fees, but the allowance plan will help by paying for those fees and reimbursing those fees. With the health benefit plan, it does have no deductible, it has no coinsurance, those out-of-pockets we mentioned before aren't even on that plan. But it does have a $5 office visit copay, and there's also a $25 emergency room copay. The health benefit plan, while that does cover a lot, it does have specific benefits, exclusions, and limitations that can apply. So those of you that are eligible for the benefit plan, we recommend that you please review the member guide for the health benefit plan. I'll show where you can find that later. Another difference is on the allowance plan, there's no network of doctors or hospitals needed, since you will likely use your other insurance's network of doctors and hospitals. On the health benefit plan, you're going to want to use its network, which is going to be the First Health PPO network. So you want to go to the doctors that participate with First Health PPO. The allowance plan is going to cover for pre-existing conditions. Really, it covers anything that your other insurance usually does. And then it pays for the copays, like we mentioned. But the health benefit plan excludes coverage for pre-existing conditions. So if you do have a pre-existing condition, that might be a very personal part of your choice between these coverages.
So maybe you don't currently have primary insurance, but you are applying or looking through the marketplace to sign up for primary insurance or applying for Medicaid. You may also be wondering if you still are in this process. Can you sign up for the VISTA health benefit in the meantime? So the answer is yes. You can enroll in the health benefit plan for 60 days. And in this time, we recommend that members apply at healthcare.gov. If you end up purchasing a plan or being eligible for Medicare or Medicaid, you can sign up for the plan and complete the IMG form for the healthcare allowance plan.
All right, thank you, Khadija. And please keep in mind these options as we're now going to show you how to enroll in a plan. So first we're going to take a quick look at the IMG website for VISTA members. Which you can see here on the screen. There's also the URL available there. This is important that you go to this website. International Medical Group, we do have a regular business website of www.imglobal.com, but that's not where you're going to go for your benefits. You're going to go to AmeriCorps.vista.imglobal.com. So please make sure you use that website when getting information on your benefits. The first page is going to greet you. It's going to include a few key buttons. A lot of the information we just went over is actually based on information from this website. So if you need a quick refresher later on, if you zoned out a little bit, we all do it, you can go to the website and find some of the information on which plan is right for you. You can also click My Benefits or Member Resources at the top of the page to get copies of the member guides for frequently asked questions, to search online for a medical provider in the First Health PPO network, or to connect with a telehealth provider, which you can see also straight in the middle of the front page. The first step, though, as a VISTA will be to make your My IMG VISTA account by clicking on Member Login, which is the button on the right side of that page. There's also a button on the right, top right of the page. After you do that, you're going to be taken to a login page, and on the right side you'll see it says Create an Account. So you'll click on Create an Account, and that's going to take you here. And this page is going to ask you for your member ID or your NSP ID number. That's so we can link up the account you create to the benefits we have on our side for you. Your member ID is what IMG has for you, and it's going to eventually be the ID number for your benefits. But if this is your first time enrolling, you likely don't have this yet, and that's normal. What you're going to instead enter is your NSP ID number given to you by VISTA. And there is a note under that field that tells you that make sure to put leading zeros ahead of the number so it's 8 digits long. So, for example, if your NSP ID number is 1, 2, 3, 4, 5, 6, 7, that's 7 digits, you need to add one more 0 to the front to make it 8. So then you would enter 0, 1, 2, 3, 4, 5, 6, 7. If you happen to not know your VISTA NSP ID, you can locate this on your My AmeriCorps member homepage. Then you can enter your date of birth, just as it's shown there, and click. There's also a calendar if you want to click there and find your date of birth through that, and click on Next. We can't show the next part, unfortunately, but just to let you know, it's just going to ask you at that point to make your own username, make your own password, and give an email address in case you happen to forget your password. Then we can send password reminders to it. But that'll make your My IMG VISTA account. And after you've done that, it's going to take you right back to the home page. But from there, you can go to Member Login, enter your account information you just made, and once you've logged in, you're going to see the same page, but a few things are going to change. Everywhere that it says Member Login, it's going to say My Account. And the My Account button on the top right, where it says Member Login right now, is going to turn into a menu. And that menu is going to contain everything related to you personally as an AmeriCorps VISTA member on your health coverage. So that's where you can go to see your claims. That's where you can go to get an ID card copy if you happen to need one in the future. And that's also where you can go to click on enrollment. And when you click on enrollment, that's going to give you the online enrollment form where you can make your plan selection. And something to just let you know, today, if you happen to have not enrolled yet and you're just starting in the VISTA program, you have an option there to enroll temporary on the health benefit plan for 60 days. And you can do that right now. You can have coverage right now. If you still want to weigh options on the marketplace, see what else might be available for you, find out if you are able to enroll in Medicaid maybe, then you can at least have that temporary coverage right now to make sure if something were to occur, you're all set up. So please, and then another note, you can see on the right side of that image, there's a live chat function. That gets you straight to our customer service team, and they're glad to assist you with this process. This is maybe our number one set of inquiries we get is the enrollment process. We're happy to walk you through.
Many VISTA members may still be on a family member's primary insurance, but what exactly happens when you turn 26 during your year of service and are removed from that plan? If you wish to purchase a plan on the marketplace or apply for Medicare or Medicaid, you should visit healthcare.gov within 60 days of turning 26 to review your options. You can then send an updated enrollment form to IMG with new plan information. If you have a new plan, you can continue with the healthcare allowance. But if you don't purchase a new plan and don't sign up for Medicare or Medicaid, you can contact IMG to sign up for the health benefit plan. Now we ask that members please inform IMG of the exact end date of the other plan that they were on, whether it's on their date of birth exactly or if it's at the end of that month. And a certificate of credible coverage may help. So let's pause and take a moment. Do you have any questions about selecting or enrolling in one of the VISTA health plan options?
I saw a few already that I thought might help. People saying it might not have accepted your NSPID number when you went to sign on. Something that commonly occurs is if you're very proactive and you get on this right away, you might actually be getting ahead of the game a little bit. We usually say to allow maybe 1 to 2 weeks from your start of service in VISTA. That allows us time to receive and load your information in our systems, and once that's done, everything will work exactly like we've explained. So if you're ahead of the game, that's awesome. You're doing the right thing, but check with IMG, give us a call. We'll make sure that you're in the system or not. We can give you specific instructions for you to sign up if you're running into any issues.
All right, let's see if we see any other questions around selecting or enrolling in one of the health plan options. And we'll get to using your plan next, so hold on tight to those questions.
Let's see. I see another question as well that's, I apologize, I'm having difficulty reading it. It's, let's see. I believe it, oh no, it scrolled away, I'm sorry. But I saw that there was a question if you have to switch coverage. That's something that you want to notify IMG. You can sign up with, I recommend you sign up as soon as you can with VISTA on a plan, make your plan selection. And once you've done that, if things are going to change in a month or so, notify IMG. So if you're turning 26 soon, that's a common situation. Notify us once you know your new coverage situation, or if you lose coverage and need to be on the benefit plan, let us know. You can always notify us whenever there's a change so we can make sure you're on the right plan for you.
I do see a couple more. I see a question that says, how late is too late to enroll in one of the plans?
Actually, so we do have a 60-day deadline, and the reason for that is mostly because we need you to make sure that you're on a plan. That's we want to make sure that you're not having a circumstance while you're in service where if you don't have other coverage that we can get you on the benefit plan. You can still send us your enrollment after 60 days. It's not a very strict deadline, but we want you to know that, the longer you go, the more kind of risk you're taking of not having coverage when you might really need it. And you're not going to know when you need it, so sign up right away.
Do see another one regarding turning 26. It says, I'm turning 26 this month, and I will be removed from my parents' plan. I've applied for Medi-Cal, but haven't heard back yet. Should I enroll in the health benefit while I wait, or just wait until the application goes through?
I would enroll while you're waiting because it can't hurt. You want to make sure that you're covered in case tomorrow you happen to experience an injury. We hope that doesn't happen, but that's the point of these plans, to make sure when the unexpected happens that you're taken care of. So be proactive, get on a plan that's going to apply for you right now, and when things change, reach back out to IMG. We'll help get you adjusted on the correct plan. So if you, in this person's case, if you have no coverage right now, we can get you on the benefit plan. We can even do the temporary option for 60 days if it's still close to the start of service. Or we can just place you on the benefit plan, and then when things change, notify us. We'll try to be as flexible as possible and help make sure you're all right.
All right. So keep on coming with the questions. We will get to some more toward the end of the presentation, and we're going to keep on trucking ahead with using your plan to access care.
Okay. So now that you've enrolled, the next thing that we want to look at is how do you actually use your plans. So apologize, it doesn't get any simpler from here. Health coverage is a complex topic. So also, do keep in mind we're going to be talking about two separate plans that work differently. So answers for one may be different from the other. I'll do my best to separate how they work for each plan. So when using your plans, first thing you're going to have to do is find a medical provider to actually use the plan with. So this is one of the ways it's going to differ between the two plans we mentioned before. The health care allowance plan, you're going to use your other insurances network. Health benefit plan, you're going to want to use the network for that plan. It's very important, though, that you, before even needing to make an appointment, and that you try to get an understanding of your coverage ahead of time. You don't want to go out to have an appointment and have some sort of procedure or something done just to find out only after you've already done all that that it wasn't something that your plan provided coverage for. And this is advice I would give for any coverage you have, regardless of whether it's the health benefit plan now or in the future, a health insurance that you have in the future. Because if that were to occur, you're going to end up being responsible for the payment as the patient. And we don't want you to get any surprise large bills. It's not what IMG wants. It's not what VISTA or CMCS want for you. We want to make sure that you're getting the most out of your benefits and that you're getting taken care of. So we're here at IMG to help you take the best advantage of your benefits offered on these programs. So the reason I bring that up here as well is to make sure you look over your benefits now when you have a chance. Take maybe just 10 minutes to read your member guides, and contact IMG anytime, even before you even have to find a provider. If you just have a question, even after this presentation, if you want to give us a call, we'll be glad to help. So regarding finding a provider, though, for those of you on a health benefit plan, you're going to be using the First Health PPO network. And what's PPO network? That stands for Preferred Provider Organization. And that's basically just a network or list of providers, physicians, hospitals, labs, urgent cares. They're all contracted together as part of a group. They agree to bill directly to or send claims to insurance companies, plan administrators like IMG at specific rates. In general, when it comes to using insurance networks or like the First Health Network, it's always a good idea to go to providers that are in network. This helps with those providers recognizing and accepting your plan, and it's going to help you on the benefit plan, making sure that those offices bill IMG for your services and that they're not asking you as the patient to pay on your own out of pocket up front for the whole cost of the service. So on our website, we mentioned before, if you go to My Benefits, which is a menu on the top of the page, it'll have an option for Find a Provider. If you can't access the website, you can call IMG. We'll help you find a provider as well. It's important when you do, now that you've done all that and you found someone, when you're calling to make the appointment, make sure that provider's office also knows what network your plan uses, since they might not be familiar. So if you're on the health benefit plan, let them know my plan uses the First Health PPO network and ask if they accept plans in that network. Once you're at your appointment, make sure to bring your ID card, because you'll see on your health benefit plan ID card at the top, it's going to have the logo for First Health, so they can see that there again and recognize it again. They're also going to use the information on the back of the card to have IMG's billing address, so that's how they know where to send their bills. And also our phone number, if they have any questions, if they're unsure of anything, that gives them a way to contact us. So make sure to have your ID card, keep it in your wallet at all times, and do that. So failure to use a network provider may mean they bill you up front. So that's why it's important to go in network when possible. You can still go out of network, but there are some limitations there as well. So also, if you do go to a medical provider and don't give them your ID card, or you don't give them enough information to know that they accept your plan or where to bill, then they're likely just going to bill you, and that's when you might end up receiving a bill in the mail. I recommend you have those conversations while making your appointment ahead of time. Ask the office if they expect to pay up front or not before you show up. This is something I actually do myself, knowing that things can get confusing. They see 100 plans a day. I want to make sure that when I show up that there's no misconceptions or anything. Help their office staff out, be upfront with what your plan is a part of, and they're going to be able to be prepared for you at the time of the appointment. And also, as a reminder, the allowance plan we mentioned before has no network. It's specific to your other insurance plan. That's the network that you will want to go be a part of. We're not too concerned with what provider you go to if you're on the allowance plan, but your other insurance may be. So make sure you check with them. Here's a few types of care that you might use your plans for, so whether it be appointments or even walk-in. But we'll start on the left with preventative care. Preventative care means that you're not experiencing any issues, but you do go get something medical done anyway. Most people, you might think of an annual checkup. You're not sick, but you go to the doctor and they take your blood pressure and they give you a physical. If you're on the health benefit plan, I do want to mention that that actually is not covered. Routine physicals are not included on the health benefit plan. But we do include women's wellness exams with gynecologists, and there's also other routine or preventative benefits as well, like immunizations are included on the health benefit plan. Urgent care centers are basically walk-in clinics or walk-in appointments. You want to use those probably when you're sick or hurt, but you're not in any emergency circumstance or danger, but you don't want to go through the trouble of making an appointment ahead of time. Do especially bring your ID cards to urgent care centers, though. For this, you want to use those for pretty much the same things you would make an appointment for, but you just want to walk in instead. And then last on this slide is the emergency room. That's going to be when you are experiencing any emergency injury, emergency illness, if you're in any emergency pain or anything like that and you need immediate care. Never hesitate to contact local emergency services or 911 if you are in danger. That's something that these plans are meant to help you with, especially if it's an injury. These plans are both meant to help you out. So know that. ahead of time, and then make sure that you yourself are taken care of. Afterwards, you can contact IMG. We'll help guide you through handling any of the bills or anything for those services. We'll help you out afterwards, but be healthy first.
We know that VISTAs are serving all over the United States, and it might not be possible for you to find an easily accessible clinic or hospital in your service area. So let's talk a little bit about what to do in those circumstances. You can use the My Ideal Doctor telehealth benefit. This is accessible for those of you on either plan. And My Ideal Doctor is like a walk-in clinic, but it's over the phone. So it can be useful for common illnesses like the cold or the flu and other non-emergency illnesses. You'll be able to speak with a real physician about your symptoms, and you have the ability to send pictures if needed to inspect a rash or any other thing that you might want to send a picture of to get an additional opinion about it. They can also prescribe medication to you for pickup at a nearby pharmacy, and you can also schedule mental health counseling services as well. And these visits have no office copay. They're billed directly to your plan. So in order to use this service, you'll have to go to AmeriCorpsVista.imgglobal.com and click on the Connect with a Telehealth Provider link. From there, you would select your plan and create a My Ideal Doctor account, or you may call and let them know that you're with the AmeriCorps VISTA program. An important note, prescriptions are written when deemed medically appropriate. So no DEA-controlled substances, antipsychotics, or lifestyle drugs will be prescribed. Coverage is only available while you're in active service, so do keep that in mind. Also, mental health provider availability may be limited in some states, but if no My Ideal Doctor counselors are available in your state, you'll need to look for a First Health PPO network provider for an in-person appointment at that time. Additionally, you can contact IMG for assistance with this if you're having issues finding a provider in your network.
All right. So now that you found a provider, you went and had your appointment, got checked up on the prescribed medicine and all that they're going to do to help you out, that means there's now a bill. The provider is going to be needing payment. You know, not many things are free, so they are going to usually find a way to send a bill. And sending a bill is sending a claim. They're really kind of the same idea, so it's almost interchangeable. So let's talk a bit about filing a claim. So normally if you go to an in-network provider and you ask the provider's office, they will bill to IMG directly, or they'll send their claim to IMG directly. If you do receive a bill from a medical provider's office and it does not look like IMG was billed, please make a quick call to that provider's office billing phone number, which is going to be on the balance due statement. Make sure they actually got IMG's information. This is actually one of the #1 reasons you might see a medical bill. Most of the time their billing office simply hadn't gotten the information on where to send the claim, or they may have entered it wrong. People make mistakes. So maybe they had the wrong address and they did send the claim to your coverage and they'll say send it, but they sent it to Arizona. We're not in Arizona, we're in Indiana. So that happens. So check with them first, and then afterwards, if there's still any issue, contact IMG. We'll take a look and find out what we can do to help further. But I always recommend be proactive. Call the medical provider to ask about that bill. If they don't have any response to a bill that they're sending, then they're going to send it a few more times, and they're still expecting you to pay. You don't want to be held responsible for something that is covered by these plans. That's our responsibility. So usually the #1 issue is it doesn't get to us. So if it gets to us, we can take our part in providing your benefits. It's important for you as the patient also to authorize the medical provider to file the claim to IMG. Usually this is part of the paperwork they have you do in the office. They'll make you sign a HIPAA authorization to release the bills and information to your medical provider. So you'll agree to do that. But in case they haven't gotten our information, or maybe that wasn't done during your visit, You calling them and telling them to bill your plan is giving them permission as a patient. Without you doing that, without you giving them permission, they can't send your private health information on the bill to really anyone. They have to protect it. So that's why you might want to get involved. If you receive a medical bill, check with the medical provider, get involved there to make sure that they understand that they can send it to IMG. And then if you actually ended up paying for a medical service on your own, that means that you're going to need to file an insurance claim yourself, which is about as fun as it sounds. So bear with me. I'm going to be very specific here with my words. And really, I always recommend contacting IMG when you have to file a claim yourself. We'll walk you through the whole process. I don't expect you to memorize it right here. But when you're submitting a claim, it's really just claiming to a coverage provider that, 1, I had this service done. 2, I believe this service is part of my plan. 3, as part of my coverage, you did agree to pay for this IMG or the VISTA health benefit plan. Or 4, here's the supporting documents to prove the service is part of the plan and how much to pay me for those services. The claims analyst is going to receive all that information you send in with the claim, and they're going to look at all the supporting documents that you provided. They're going to compare them to the same benefit plan that we have posted online for you, and they're going to make sure what you sent clearly matches up with what your plan says it covers. So simply sending a balance due statement or a cash register receipt saying you paid $200 to someone, that's not going to give enough information to a claims analyst. They might need to know a little bit more detail than that to know that it actually is part of what your plan would include coverage for. So a lot of times this all happens behind the scenes because most health care providers are going to bill directly to your plan. What's actually happening when they do that, though, is they send a claim on your behalf, just like we mentioned above. They say, we believe you should pay on behalf of this person. Here is information to describe what happened. Please pay to us if that circumstance is covered by their plan. And if not covered, notify us. Then we will bill the patient. And then whoever files the claim is responsible for providing proof of their claim, which means that they need to include with the bill enough information for a claims analyst to say back, we agree, and pay. So with all claims, we recommend you try to include the following, which you see listed here. An itemized billing statement, which would explain what specific services you had done, where, by who, and when. As mentioned above, this is a really common mistake. So to reiterate, this is not just the balance due statement you got in the mail. It's not just a cash register receipt or just a bank statement. Some of that's going to play in later on, but an itemized bill is usually going to include procedure codes or descriptions or diagnosis codes or descriptions. They tell a story about what the services were for, with who, with, sorry, when, with who, and for what purpose. Medical bills include codes to do this. And I'm going to it's getting a bit into the weeds, but medical bills include procedure codes, which are healthcare standardized numbers assigned to every possible medical procedure. It tells the claims analyst exactly what services were done. They also include diagnosis codes, which are healthcare standardized letters and numbers that are assigned to every possible medical diagnosis that tells the claims analyst the purpose of the procedures done, what diagnosis was being treated by those procedures, or you could even say that it was a routine checkup. Medical providers know them as CPT codes for procedure or ICD-10 codes for diagnosis. I really don't expect you guys to memorize that, though. Almost all medical providers will be the ones that know what those are. And they're going to be familiar with that if they've ever billed to any insurance company ever, because they're required. If you're not sure what you have, before you file the claim to get your own reimbursement, call the medical provider and ask for an itemized bill with codes. They'll know what that means. Tell them that you're sending a claim to your health care plan. And another thing that you could do is if you paid out of pocket the same time you were leaving the appointment, if they did it as part of your checkout of the appointment, ask them then for a copy of an itemized bill. Let them know, hey, I'm going to be sending a claim for this to my health plan. Could I get a detailed itemized bill that includes the codes? They'll know exactly what you're talking about. And then if it's for a prescription, you actually get everything you need for a prescription claim at the pharmacy when you pick up the medication. They give you a detailed pharmacy prescription receipt. It's usually rectangular looking, kind of like a sideways rectangle usually, and it's going to give all the information we need to process the claim to reimburse you for that prescription. Also, at the pharmacy, you're going to get a really long receipt, and that receipt acts as proof of payment, which is our next bullet point. Proof of payment is any document that shows how and when you paid. Usually it's a cash register receipt, like a really long one you get from most pharmacies, or it's an invoice that says the patient paid, or it's a bank statement showing matching payments. So if you paid with a credit card or a bank card, you could go online to your bank account and you can find, hey, on this date, I paid this office. And that's proof of payment. That's all we need to know. Or it's a front-back copy of a cash check, which if you're old-fashioned like me and you still use checks every now and then, you might be able to get a copy of that from your bank. Proof of payment is needed so that we know you're the person that IMG needs to pay to. Because if we don't know, if we receive a bill for a medical service but it doesn't look like it was paid for, we might assume, oh, the medical provider's office still needs the payment, which would be great. If that was the case, we'll send the payment to them. That'll settle your account. That's wonderful. But if you've already settled the account yourself, oh, now it's going to just take more time for the money to get to you, the person who needs it. So make sure to include proof of payment for anything you're claiming to be reimbursed for. And then the last thing to include is the correct claim form. Just make sure which plan you're on. There are two different forms, the healthcare allowance medical reimbursement form for those on the allowance plan, and the health benefit plan claim form for those of you on the benefit plan. It's because those plans include a few different criteria for what we need with the claim. They'll guide you through it. That slide took a while, so I promise we're almost done though. For the healthcare allowance plan members, because you all have another insurance that's involved as the primary insurance plan, we're going to need a copy of your other insurance's explanation of benefits letter. That letter, or EOB letter, is going to give the results of the insurance claim with that other insurance. Even our company is going to send you a copy of those whenever we complete a claim. Our claims analyst is going to need to see the results from the other insurance so that they know that the other insurance actually finished processing your claim. It's going to tell us what the copay, deductible, and co-insurance were on your other insurance plan. So it's going to say, this is out of pocket for you on that other plan. So the allowance plan will know, okay, well then that's what we take care of. Also, that similar information is going to come from us, as I mentioned. So when we finish processing the claim from you, even if the provider sent it to us, not you sending it to us, there's going to be an explanation of benefits letter. You can view it by going to your My IMG VISTA account online on the website we demonstrated earlier. And really, the most important part of the EOB for you as a member is the patient responsibility and remarks section. That's going to tell you, do I owe anything? Or it's going to tell you, if you do see something there that you owe, it's going to tell you, wait, why would I owe that? And the remarks will give you the full details of what went on. If you do see an amount listed as the responsibility to pay for you before you worry too much, check the remarks section, as I mentioned, for listed reasons as to why, then give IMG a call. We're here to help maybe figure out what might have went wrong with that claim. Keep in mind also that a claims denial is not the end. It sounds bad, but it's usually not the end of us looking at things. It's simply the result of the first look at the first information received. You may be able to send more information, and we can reprocess a claim with the additional information we needed. Even medical providers might leave something out, and we have to turn it back to them. And you might see an EOB that says, oh, no, it was denied. But in the remark, you'll see, please send medical records. That's usually what we would send to a medical provider to let them know there's a little bit more you need to send us. Please send that in. And they will. It'll get reprocessed, and you'll get more detailed results. Sending a claim is telling a story. Some story details might accidentally get left out. And we're going to definitely take a look at any new details you might be able to provide. Which is also why we also recommend try to provide as much detail up front, give us the full story, and we'll be able to more accurately know whether or not something was a part of your coverage. Your claim will get processed quicker, and you'll get your reimbursement quicker. And speaking of getting help with that, our last subject for today is how to access support for your coverage. I know we went over a lot. So I would like to close by providing information on how to reach out to IMG for help later on. On screen is how you might reach out to IMG. IMG's customer care staff, they provided help for AmeriCorps VISTA members. The specific people actually have been providing service for AmeriCorps VISTA members for as long as IMG has been partnered with this program. I actually came from that team myself. I can confidently say that they know their stuff. They will be glad to help answer any questions you might have with everything we talked about today. You can reach them over the phone or via live chat if you need an answer right away. Or if you need information or you have a question, maybe something we weren't able to address, you can send an email to vistacare@imglobal.com. If you email IMG, we recommend make sure to include who you are because that's going to let us know that you're a member, and they can look up your benefit information. Also, if you're emailing about a claim, we recommend, if possible, to encrypt your emails. You might want to look however your email client works for encrypting or protecting or putting privacy on emails if you're sending anything about a claim, and make sure to include your claims information. And ultimately, we're here to help you. It's the least we can do. I just want to thank you. I believe we still have some Q&A, but I want to thank you as we went through that presentation for your time today. On behalf of IMG, also to thank you for your service to America's communities.
Thank you so much, Matthew. So now that we have gotten through our presentation, we want to know what you thought. How can we improve this presentation for future VISTA members? Your feedback is very important to us, and we would love to hear what worked for you, what didn't work. Really take this time to provide your input and your feedback to improve the session for future VISTAs. Please take a moment to complete a brief survey. You should see that webinar survey link directly under the chat. To access the link, you will first highlight or select the link in the pod, and then you can click Browse to. Note that double-clicking that link will not work. And for those of you on a smartphone or a tablet, the survey link pod may not work, but we will be sure to post it into the chat. Thanks so much, Julie, for doing that. And in the meantime, we are going to get to some of your questions while you're contributing your feedback in the survey. I did take the time to export the Q&A pod, so we will be getting right to your questions. Some of them we did answer, but it seems a lot of you have similar ones, so we're going to get through as many as we can with the time we've got. So a few of you are asking, I've tried many times and the website just doesn't seem to accept my NSP ID. What do I do?
Best thing you can do is contact our customer service. We're going to be able to take a look at internally at what our system is showing for your NSP ID number. We'll verify that your information loaded in correctly. There are times where, computers aren't perfect. When we get the information from VISTA that you've begun work in the program, maybe something went wrong. That's something we can troubleshoot for you. So if you're having any trouble, if it's stopping you from being able to enroll, we'll help you get past that point so you can get on a plan.
Awesome. I'm seeing another question that says, what is an HSA, and is the healthcare allowance plan the same as an HSA?
A health savings account, or an HSA, is like a bank account specifically for paying for medical services. The healthcare allowance plan is different from that. We do need to review claims, whereas an HSA is really just like a credit card. So those will be the main differences there.
Let's see. When I enrolled, I had different health coverage. Now I have Medicaid. How do I inform IMG of the switch in primary insurance coverage?
I think that's something we touched on a little bit earlier, but I'll get more specific now that we're through most of the presentation. If you need to notify us of a switch in coverage, we have both the online enrollment form, and there's also a paper enrollment form under member resources on the website. That's actually helpful for notifying us of changes because it'll ask you for when your other insurance ended, and that lets us know when exactly that change occurred. So you might get recommended to fill out the paper enrollment form, but you can send that in, mail, fax, secure email if possible, just to make sure your information is protected, but you can send that to us that way as well.
Let's see. I started service in November and enrolled in the health benefit plan. Am I eligible to try to enroll in the Kansas marketplace where I serve when the open enrollment period opens for the Kansas marketplace?
Yeah, absolutely. The one thing that I want to point out of there being two plans is this is meant to give you a bit of power. If you want to get better coverage in the health benefit plan, we definitely encourage you to do so. You might not even have to wait until that open enrollment. As part of VISTA service, for 60 days from the start of your service term, you have a special enrollment period with the federal marketplace. You can actually Google a special enrollment, and you'll see special enrollment AmeriCorps VISTA. It'll take you right to the page that describes it all on healthcare.gov. So that's actually meant to help make sure that you're able to explore your options, and then we can switch you over to the allowance plan if you were able to get approved for the Medicaid in the state you're serving in. And that's actually very important as well for those of you who might have already been on Medicaid in the state you normally reside. When you come out to work in VISTA, if you're going to be working in a different state, you're going to want to check again with the marketplace to make sure that they get you on the Medicaid for the state that you're serving in. People's eligibility is going to vary, so there's not ever a total blanket answer for who or who will not be eligible for Medicaid. Varies state by state as well. But I definitely recommend most of you do look into that. Do go to healthcare.gov, follow through the process there, see if you're able to apply right now, see if you're eligible for the special enrollment period, and see if you can get on Medicaid for your state, because that's going to help you a lot.
And there have been quite a number of questions regarding dental and vision coverage for both plans. Can you say a bit more about how that works?
There are limited dental and vision benefits for both of the plans. Dental is, actually, I don't want to quote the exact benefits. I recommend to look at the member guide for the plan that you're enrolled on. But they are there to help, and they differ between the plans, so I can't really give like a blanket answer, but there are dental and vision benefits. I did see another question that was about how does dental reimbursement work? So that's basically how do you use it. Dental, whether you're on the benefit plan or the allowance plan, there is no dental network. First Health is a medical PPO network. This means you can go to any dentist, but like how going in network with First Health helps make sure the providers bill directly, since there's no network, you will have to ask the individual dentist office if they can bill your plan. And some will, some won't. Make that part of making your appointment. If you want to make sure that you're avoiding out-of-pocket expenses, make sure you go to a dentist office that's going to work with us. And we also get calls from dentist office. We're glad to explain how the plan works and how your benefits work. So usually once they get in touch with us, that clears that up pretty easily.
Let's see. Someone's asking, what about allergies? How does that work in either plan?
Allergies, I would make sure to look at the plans. I'm actually going to try and double check some information myself, but I want to be careful not to get too specific on the benefits because those can change, and also your individual circumstances are going to decide a lot of how the benefits are going to work. So allergies, there are some limitations on the coverage on the benefit plan. I believe it's allergy testing may not be included, but there are some ways that they may be covered as well. Make sure to contact us for any specific questions that apply to your health.
Let's see, for our LSI folks, are there any questions over the phone?
Not at this time, there's not.
Thank you so much. Let's see.
I just want to expand. Sorry.
No worries.
I saw a question about vision, and I apologize. I really only spoke to the dental side of that first question. But someone mentioned our contact lenses, glasses, lens exams covered under the allowance plan, if not covered by the primary insurance. Yes. Routine vision is part of the benefits. It's limited, so make sure that you're aware of any limitations and check with the vision office how much that appointment might cost you. So that way you're taken care of.
I'm seeing a number of questions regarding what folks can claim under the healthcare allowance, and asking if there's a list of things so that they can know.
Yeah. Just like the health benefit plan has a member guide, the healthcare allowance plan also includes a member guide. They're both available on our website. I will say the number one criteria we're looking at for the healthcare allowance plan is it a copay, deductible, or coinsurance on your other insurance plan? So start with your other insurance and what they cover, and then if they say, yeah, we include coverage for that, but you haven't met your deductible yet, then that's what the allowance plan will help you out with. So it's a lot more flexible than the benefit plan because we really look at what your other insurance did, and we help with the out-of-pocket.
All right, let's see. How long does it take for a claim to show up on my account?
Claims will show up on your My IMG VISTA account when they're completed. The reason for that is the account actually pulls straight from our claim system, and it shows you the explanation of benefits letter. So it might be on file. You might not see it yet. Our processing time is usually, we quote 20, 25 days for processing. That's really kind of standard. It could be shorter than that. So we try to return them as quick as we can for this program. We care a lot about you guys, and we know that, especially if you paid out of pocket as a volunteer, that hurts. So we try to make sure to turn these around as quick as we can. But all claims are processed in the order they're received. If we have a lot of claims in office, then it's like more people being in line. So do be patient. And if you ever need us to look into the status of your claim, That's another thing you can definitely give us a call about. You can send us an email, connect to us via live chat. We'll look up the claim. We'll find out where it is, and we could probably give you a better estimate of maybe how much longer it might take to complete.
I have a question about it. In what form will you receive the reimbursement?
That's up to you. So if you do send a claim for reimbursement, you have the option of either a check, which is our default. So if you don't tell us what to do, we'll probably send a check to your mailing address. Or you can ask for an ACH transfer, which is direct deposit. So if you want direct deposit, there is also a form that can go along with the claim form where you give bank information, and we'll use that to just directly deposit the reimbursement to your account. And I recommend that. It's so much easier. It's so much easier than tracking down a check. It's so much easier than finding time to go to the bank. So if you are sending a claim, make sure you look for the ACH. It says ACH or wire transfer form, but it's really just ACH in America.
Let's see. How should we identify ourselves via email? Is it better to include our name? Do I also need to include my insurance ID?
Honestly, really name and date of birth. That's like the bare minimum. Sometimes even your name could be enough because we could match it up to the email address. But what I just want to make sure, what you want to prevent is sending an email and we can't match it up and then we have to email you back and ask for that information. It just makes more time for you to get an answer. Look, name, date of birth, or your member ID, or even your NSP ID. Those will all help us match up. I mentioned earlier in the presentation I came from working in our customer service. That's what I would use to find your information when answering an email. So yeah, that'll help.
How do I find out when my IMG allowance expires?
Your coverage is going, oh, I apologize. There's two parts of that question. So whether it expires on time or whether it expires in the amount that's covered, because the allowance plan does have a limit. It varies year by year. So let's start with the time. These coverage plans are available for you while you are in service as a VISTA. So once your service term is over, on the exact date your plan is going to end. So be aware of that. If you've been in VISTA for a bit and you're coming to the end of your service term, you might want to start preparing to look for other coverage. Look at the healthcare.gov marketplace, for example. And with the amount on the allowance plan, I will say most people really don't reach that amount. It varies every year. It's the maximum out-of-pocket that you owe on ACA or Affordable Care Act compliant plans. And they increase that year by year. So the idea there is that your other insurance is going to have a maximum amount that they would charge you before they pay at 100%. We cover up until that time on the allowance plan, with some exception. If you do use dental or vision, that's going to subtract out. If you're concerned about reaching your limit, contact us. We'll look up how much is left on your allowance. We don't exactly have a way visibly at the moment to track that. That's something I might keep in mind as we look at ways to improve.
Oh, I see one. The billing staff at my doctor's office had no idea what I was talking about when I tried to explain the IMG VISTA allowance plan. How do I explain this to them so that they can submit the claim to IMG?
It happens. And as much as we'd like to say that this plan is more well-known, they see a lot of insurance plans. They see a lot of companies. The best way to explain it is to go by the network. As I mentioned before, you're going to want to mention your plan uses the First Health PPO network. From that office desk person's perspective, when they see a plan, they're going to look, are we in network with this? And they're going to look at the logo First Health, or if you tell them over the phone it's First Health, they're going to look at all the networks that they participate with. They probably have some sort of master list, or it's in a computer program for them to look up, and they're going to see, oh, there's First Health. Okay, yeah, we do take your plan. They will not recognize IMG probably, and they will not recognize AmeriCorps VISTA as a health insurance. They hopefully recognize all the great service you guys do, but you know, when they're looking for insurance plans they accept, they probably don't have that in their list. So First Health's what they should have in their list.
I see one here from Jill. It says, could you talk about some of the preventative care we can receive through the healthcare benefit? I see in the covered benefits dental, cleaning every 6 months, vision, GYN. Are there others?
It's really what your other insurance covers. Since you have, to be on the allowance plan, you have another insurance, and that insurance is probably, to use a technical term, it's minimum essential coverage according to the Affordable Care Act. The Affordable Care Act puts certain terms in place that insurance plans must adhere to, and one of them is preventative care. So almost all insurance plans provide you preventative benefits. A lot of times they're not even subject to your deductible. So a lot of times when it comes to preventative on the allowance plan, that's probably going to be fully covered by your other insurance. Check with your other insurance plan. Things could vary, but that's almost like a standard at this point. And if you do end up having a copay for preventative on your other insurance, if you have a deductible, maybe a lab test was done that they didn't consider part of it, then that's going to be filed to the allowance plan. That can be considered.
Let's see. Where do I find the member guide?
I think in the chat there's been a few links. I saw Chris posted it just a few moments ago. But you can go to AmeriCorpsVista.imglobal.com. At the top of that web page, there's a menu for resources. And one of the options is the member guide, I believe. I'm going off memory. I apologize. Yeah, that'll be it. Or you can go to My Benefit, and then there's both Health Benefit Plan and Healthcare Allowance Plan. They'll give you some descriptions on what they do.
Let's see. I'm not seeing any other questions that we have not yet answered. As a reminder, folks, please enter your questions into the Q&A pod, and we will be sure to answer.
I saw a good question. Someone had asked, are mental health services part of the health plan? They are, for both plans. In fact, that's a really good question to bring up because mental health actually works a little bit different on the health benefit plan. Normally the health benefit plan does not cover pre-existing conditions, but for health benefit plan members, for mental health specifically, you are allowed 3 visits that are not subject to that exclusion. So a lot of times what you could use that for is, let's say, if you are on a mental health related or behavioral medication, something, some sort of maintenance medication that might require seeing a psychiatrist every now and then to get refills of the prescription or to get it evaluated, you could use those 3 visits for that. So even if it's a medical condition that a mental health condition, I should say, that you had before service began, there are benefits for office visits for that. Also, I think that brings up another good point. Prescriptions are not subject to that either. So you can have a pre-existing condition that requires maintenance medication. You can get that medication. It's covered by the health benefit plan anyway. It's just like office visits or other medical services like labs, they might not be. And again, I recommend for those of you that have pre-existing conditions, explore seeing if you're eligible for Medicaid in the state you're serving in. That's going to take care of you. That's going to help take care of you for a pre-existing condition probably.
I see one that we have not answered. I have the allowance plan, and my primary insurance is not present in the state that I'm serving in. I've been told that what I need to do is coordinate these 2 plans, confirm that a certain visit is covered under my primary before I have that visit, then collect the denied claim from my primary and submit it to IMG. What sort of
That's mostly
reimbursement coverage can I expect?
Sure. When it comes to your insurance plan's network, that's something, again, it's going to vary depending on who your other insurance provider is. So I apologize. This is not a very, it's hard to give blanket statements, so bear with me. Your other insurance has a network, and if your other insurance only exists in, let's say, New York, and you're doing work in Massachusetts, things are going to be things might change, especially Massachusetts. That's actually a little bit more complex, but I can't go into that. You're going to want to make sure if they have out-of-network benefits, because you're probably going to go out-of-network. They probably didn't even make a network for your plan in the state you're doing this service in, and that's okay. A lot of times they don't want you to go out-of-network because you would owe more. You would have more out-of-pocket, higher coinsurance. But the health care allowance plan is meant to pay that coinsurance whether it's higher or lower or whatever it is. So we still need to be second. But knowing that your other insurance plan looked at it and how much they say is actually left over is what we're needing to know to be able to process as secondary. There could be extenuating circumstances. Please, again, for your individual needs, if it's related to a claim that you have right now, reach out to us. Let us know. If there's an issue, let us know. We're really interested in making sure that you're getting your benefits. So try to work with your other primary plan, and if things start not working out, let us know. We'll see what we can do to help.
If I'm going into a second year of service, do I need to reapply for health care benefits?
Yes, you do. The reason for that is it's a good opportunity for us to make sure you still have, for those of you on the allowance plan, whether or not you still have that plan, or for those of you on the benefit plan, to let us know that, oh, I did get insurance. I should probably let IMG know that, and then we'll make sure that you're still on the correct plan for you. It's important that you're on the correct plan for your circumstance, because it's going to cause a claims delay if, let's say you're on the benefit plan, you're actually not allowed to be on other insurance and the benefit plan at the same time. So if we got a claim and it says you have other insurance, that's going to cause some confusion for the claims analyst. We might have to figure out adjusting your enrollment, and it's going to take longer for us to process. So we don't want things to take longer. We want to make sure everything's getting done as quick as possible. So let us know whenever there's a change, and also when you re-enroll, check in with us again. Let us know what your coverage status is.
Let's see, can the allowance be used on something that's not covered under my primary plan?
That's going to depend on the specifics of what is not covered, so I apologize. I may not be able to answer that.
All right. They did include chiropractic, dental as examples.
I have to apologize because there could be other factors involved. So I really recommend contacting us directly about that circumstance. There are, if it helps at all, in the Healthcare Allowance Plan Member Guide, there is a list of services that are not considered. It's very short, but if it is part of what's not covered, then it would not be something we could reimburse. For the most part, it's really flexible. So some of those things are, some may not be. It also might depend on the purpose of the procedures and things like that. So there are other factors.
And I think this might be our last question before we close out. Will any of the information of my visits be shared with IMG?
Anything that is shared with us is part of what you have authorized to that medical provider. So when you go into a medical provider's office, you tell them who is allowed to get your information. Now, I understand privacy is a huge concern, especially nowadays, look, I had my credit card information leaked from various people, various market stores and things like that. Especially health information, though, because that's so personal. It's so very personal. And you might not want some people knowing maybe what the purpose of your visit was. For us to be able to properly process your claim, we really, at bare minimum, need to know why were these procedures done. And when they send that to IMG from the medical provider's office, first off, that's only after you've authorized them to do so. And then second, they, as a medical provider, have to send it to us in a secure method. So they either send that by mail or they send that to us in a secure fax line, or they send that to us in a secure electronic method that's set up for medical providers to bill with. Once we get that here, we are actually required by AmeriCorps or VISTA to have very strict privacy requirements. Only certain people are allowed to ever see that information. So I don't want to get too into the details on that. I just want to stress that's the level of security we keep with your information. That's how we understand how private and important making sure your health information is not seen by those who would not be involved in what's only necessary to process your claim. If you do have any concerns with that, make sure to raise them at the time of your medical appointment. You might be able to, the medical provider might be able to work something out with you, or reach out to us again directly. I apologize, it sounds like I'm repeating myself, but let us know, and then we can try to address any concerns you have directly.
Thank you so much for answering all of those questions, Matthew. And with that, thank you all for attending this webinar. We hope that you can join us for next month's webinar. Be sure to check the webinars page under Connect and Learn to sign up for future webinars. We hope to see you again. Thanks.